multi-tiered approach. I think a part of this support has already been started yesterday for the curricular development of the curriculum. So the new areas of the first. The Medical Council of India gathered all the departments of medical education in India, discussed with them, and whatever suggestion, not only just with them, that they took the feedback from all the stakeholders that we have been talking yesterday, from all the stakeholders in the society, and they came up with a view that this suggested needs to be included. That is, foundation course, integration, both vertical and horizontal, early clinical exposure, skills training or competency-based training, and these are all the areas lacking. There is some deficiency in all these areas. Maybe we are doing it somewhere, but there's a lack of a well-defined curriculum for this. And electives, student doctor clinical training, meaning when the students generally want to include 82 students in the rounds and as a doctor. After once they are interns, maybe we include them. But when their students, include them in the rounds and make them give prescription examination, give them training like a doctor, and then their student nurses. Then secondary hospital exposure. That is because most of the time their hospital exposure is at the tertiary level. Right? They are going to most of the medical colleges at the tertiary level. So let them go back to the primary health centers or community health centers, secondary care, other centers. Then you are training with techniques like skill labs. I think many of us use the skill labs. Those who have visited trainings like we have, and of course many other colleges have, we had made using the skills lab there, where there are many simulations where you can practice many of the skills of the animals. And community-oriented education, which is very much lacking. But what they thought was all these areas that were suggested, but of them, they took few of them a top priority, which is the basic need for a change, and that can be implemented from the first phase. So they chose these 4 areas: foundation course, integration, early clinical exposure, and skills training, which will be implemented in the coming year 2014 July batch. The first year's batch. And as yesterday I was saying, highlighting basically this, they are planning to basic this implementation. Probably this works out. Another 1 or 2 years, they are going to implement further step by step on the changes. So now our concentration, from now onwards, our concentration will be on these 4. Okay. They also thought of certain challenges, like as we lost when we have yesterday I mentioned that we are planning for implementation, think of the challenges and overcome them and find the strategies to overcome them. They felt that it was multiple level. How many colleges are there in India? Medical colleges? 340 medical colleges recognized by NCR. As per NCR, there are 350 medical colleges, and all the colleges at the same level, at the same time, includes the big challenge. And multiple stakeholders. Really meeting the ability of regional representatives, DO and papers. Not that the purpose, SSIMSRC is a very well-trained faculty are there, social active people are there. Maybe they can implement, but not every college is the same. So there is a very ability in every data that you implement. It cannot be possible, that is what the challenge. So develop modules in context to reforms. You have to develop, like yesterday we said, develop the resource materials. For that, whatever is required for all these changes, each college is to have or prepare. Develop motivation of NEO and directors for change. This is very important, right? Unless the heads decide to change, nothing moves. So motivation for the NEO medical education units, because their active involvement is very important here, because they are the people who are going to train every other faculty in the college, and directors, they have to have that motivation for change. Faculty development rather than the workshop elements. Morning, somebody mentioned. So we will talk for only for that. So development, okay, we participate. change happen at department level. Because each department level, that same change has to happen at all the medical colleges the same. That these are all the bigger challenges for the MCI and civil. For that, they did a post-field analysis. Post-field analysis is something like we always discuss and analyze what are the factors for and what are the factors against the implementation. So what has happened, the factors for was it's an MCI initiative. First one, naturally, if I want to change mobility, if I say something mobility, MCI puts it mandate. Because it's an MCI mandate, it has to be done. So somehow we do it. So that is one factor against this coming from the MCI. Let's stepwise implementation. Instead of putting it on, if you put stepwise, we will implement it. Because practically applicable. Then that's why they chose the only selected areas. We selected areas and stepping in, not phasing in. So it would be possible. What are the factors against this? They have to develop a new network for this. How should the MCI reach each and every college for this? For that, they have to develop a network. At the end of this program, I will just show you all the network, how they plan the network for this implementation. They have to develop a new network and make it work. Then area related capacity as I said, regional secretary is some of the medical education units. Not all the units in all the colleges are the same capacity, same faculty, same motivation. As per MCI, you must have seen that many a times medical exists only when the MCI inspection comes. After that, no one knows where the MU is. Members, everything is created and then it is sequenced. That without the MU, without this thing, they have a challenge to implement. It's short time. They also have a very short time. This was even in 2011 November, but still they felt it was short time. Now we have 3 months ahead, I don't know what is short time. Then there are 314 colleges in co-medical education. These are the factors against. And what reforms major? What major reforms they are going to bring in is, you must have gone through your foundation course. First year says 14 months. It is previously 12 months, including exams every year. That is not discussed one on both exam and all that. Including exam previously it was 12 months. Now it is moving to 14 months. The second years is made into again 14 months. It was previously 18 months. We used to have 3 terms. Now it is 14 months. The third years, part 1, part 2, together it is 26 months. Previously it was 24 months, 2 years. Part 1 was 1 year, part 2 was 2 years. So these are the changes that we can see from starting 14 months, 26, and eventually as this nothing has been changed, eventually that is true. So overall, if you see the overall course duration is 5.5 months. That is not right. It's only the internal duration within the phases tracking. If it is shifting there, but overall course has not been, the duration of the course has not been affected. Now in this 14 months, how they are divided as modules. First 2 months will be for foundation course. Once they join August and September, they can take admission somewhere in July to start, and starting from there, August and September will be for the foundation course 2 months, and from October till September, the 12 months will go as it is before. Before now and as it is going on, same as coming up will go. Then next, once they complete their exams, first year, second and this is starting in October. Then next it will have exactly 1 year, next year. But where the 2 months is that additional, now what is made 14 months, 1 year, this is 1 year plus 2 months for skills and electives. Electives is where they can choose different areas where they are interested which are not covered in undergraduate curriculum. For example, if they want to look at interested in ethics, something is technology, something is not supposed to be ecology, anything, they can choose those areas and for 2 months they can work there in those hospitals. MCI is going to recognize those hospitals also, recognize what is the ethics, and they can get trained and come. For that is must, but they have to choose. They have a choice of choosing which one, but that is must. That is must. So immediately after second phase, directly along to the third phase. 2 months there is studying some hospital for electives. There are different areas That is because there are so many times we have undergraduate medical schemes very much restricted. And they felt that it was a suggestion that many students were really good, those who are big schemes, and they have an interest that they get exposure. There is a career choices, career choices, where they are interested. Let them work, get exposed if you help them career choices, and they get more confidence in those if they can. This was the idea. It very important. So that is elective, and that is for 2 months. After that, no training, and they can just go work in those areas. Just work. If they are interested in something genetics, some genetics lab, they can go and work there somewhere. If they are interested in something immunology, they can go and work in those areas. If they are working in nephrology, because they are not exposed to all these specialities, let them go and work in those areas. Just working and coming, and we don't have any assessment for that. That's 2 months, what they have learned and all, to know there is no assessment. It's just like posting, like we have intense posting, like rural posting and all those, like we post. So like that, they have a 2 months posting.
They can go anywhere. So it is very where to go.
Yes, ma'am.
What students starting their state
They go after second year, ma'am. After their second year. They after passing they will go. After passing, before going to their third course they will go.
Because there is no hard batch exam.
As of now, what they say is there is no hard batch exam. There is no hard batch exam.
1 year.
1 year.
Madam, they can go anywhere in India.
No, sir, they are going to select. I mean, still as of now, UNC has not given those list of those places or hospitals where they can work. They will give us. They will give us. Or they have some like the DNB recognized hospitals like that. They are going to make us that. These are the centers. Like for genetics, these are the centers. For nephrology, these are the centers. So like that, they are going to give centers. Only in those, students have the freedom of choosing the center, freedom of choosing the top subject.
But not for the assessing.
Sir?
We can't assess them, no?
No assessment. It's like posting. That question is always there, sir. We are not. That question is always there, sir. That question is always there. Even for internship, we are posting them for 1 year. We are not going to see what they learn. So similarly, it is up to them. This is with a good intention that good students let them. Drawback, sir.
But how to assess them? Because there is no assessment for them.
So similarly, it is same like internship. It is same like internship where we don't assess. Then let them get. There are so many students who are interested. It helps their career choices, like future they can choose. So there are some areas. Not only this, they have 2 electives. One after this, one after third person. They have 2 electives. Yes, it is mandatory. It is mandatory. They have to go. If not, there are certain things that in the area, in their college itself, they have to work. They have to work for 2 months in the subject they have. If they don't want to go outside place or whatever. But it is mandatory.
Madam, student who has passed second year, what will we know about ophthalmology, pediatrics and
Not like that ophthalmology, ma'am. Some areas which are not taught here.
Not taught here.
Or not taught in the undergraduate. Like that's what I mentioned. Genetics. Where hardly we teach them, hardly 2 classes. Such branches. Where they are not exposed to in undergraduate curriculum, which are not exposed to, and if they feel that they are interested in something, let them go. This is only the intention.
Because there is no assessment of this selective period.
Yes, sir.
They have at least have a long book.
That long book and their whatever they have to certify. This is like we have internship something completion. So they have to get a completion certificate that this student has worked in this and this. That will be there. That will be there. But we will not assess them. That certificate will be there, the completion. For work for so many days. We will. That is different. We will come to that. The early clinical exposure is the next third one. We will come to that. We will come to that. This is like just get sensitized. There are so many questions still which MC also doesn't have an answer. I know what to answer here. Then all these asked without questions, they may go. Even the questions has come that they may go to their places wherever, Bombay, Bangalore, wherever, they take there, they adjust like they do in internship in many colleges. They take a completion and come back. They sit at home, they enjoy it, come back. So that those questions are still there. The loopholes are there for everything, and we all know that something comes up and if one this thing comes up, there are 10 loopholes found by students. So those are there. As of now, we just keep it in abeyance. We'll see then, whatever happens. And we are just sensitizing. Let us get sensitized to whatever. Okay, then they have third first, part 1. They have third first, part 1, which they have to do after this 1 year. Then they have again second elective. They have 2 electives. Whichever they can choose, in a similar manner, they have 2 electives. One is after second phase, the second one is after third first. Third phase, part 1 exam. Then they will continue with the part 2, MBBS part 2 exam. This. After this, I am sure you all have come up with something like NEET. I am sure now it is a burning topic everywhere. It is because NEET has been announced. When we were trained in May, nothing was announced. It was still kept in abeyance. And now we also went through again the NEET. They have a good website is there. They have given all the information. Where the NEET is, I'll just tell you that how it is named. After the MBBS, once they pass out MBBS, they are supposed to appear for the national entrance eligibility and entrance and eligibility. National entrance and eligibility and entrance test, that is NEET. And that is also called as MBBS exit exam. Both are same. MBBS exit exam. Exit. Because they want to win. One is for exit exam. That they are qualified now to go out. It's like overall assessment of all 4 years, 4.5 years, whatever they have learned. Plus, it also forms the basis for the common entrance. What all this MCA was talking. Now, this is coming back to NEET. This was a proposed. Now it is already come. When we were trained, it was proposed. MBBS, they go through first professional, that is first year exam. They call it as first prof, second prof, professional exam. They don't call it as year. So after third phase, they can appear to the common exit examination, that is the NEET, which it has been announced. This also forms the basis for the PG entrance. And in this exam, one is the qualification, they are qualified to go out as an MBBS. Second, they get ranking for PG course. Based on this, they will be getting their PG seats. So there will be no separate entrance examinations hereafter as per the MCR. They don't ask me later if they come up with something. As of now, what they have told. And then they go through internship. Now the internship has started the batch. Actually, it is supposed to be immediately they pass out, they give an exam, then they do the internship. This was done with the intention that because most of the students during internship forget about their skills, then whatever they have to learn, they are all interested in studies. I didn't know, I experienced it about a year, last year, and once few of the students, in final year students, they came and approached me. Because I'm little friendly with students and I'm approachable, they approach me for any problem on the earth. Not only related to pathology or anything. So they came and asked me, they are in third year, they asked me, ma'am, we want to go for PG entrance training to Bangalore, which is conducted every weekend, Saturday, Sunday. But here if you go Saturday, Sunday, every Saturday we have gynec class in the morning and gynec posting. We miss that. So they asked me, how can we manipulate or how can we manage those postings? I was surprised, PG entrance exam training, why you want to go now? You are still in final year. No madam, their training has already started. I was shocked for my this thing. I said, training has already started when you are MBBS. Madam, where are you? Which area? They have started in second phase. They said, second phase people are taking training for final year. And madam, you are saying, where do they know ophthalmology and this? Students are very much ahead. So, most of the students, they are forgetting about this. Their main goal is only for PG. So they forego this 12 months without learning anything. So with the intention that once they get a seat or once that is fixed, then they can further concentrate on their skills. That question also has come up. If they fail in the basic subjects, they have to reappear only then it starts. Then again the internship starts. Internship will start only after they pass it. Sorry. Then after internship, it doesn't end over there. They will conduct a licentiate examination. This is for assessment of the skills and competence at the end of internship. Now MCI has defined already that these are the certain basic skills or competencies that is to be attained by each student at the end of internship. They are defined. So they are going to conduct this competency based test for this at the end of internship. So there will be one MBBS exit exam and there will be one internship exit exam. So that's what, to make sure that they learn in the 12 months of internship. All these exercises are to make sure for that. Sir? The institute, like they are going to institute, they will give the guidelines, sir. They have already defined the basic competencies, like giving intramuscular injections and putting the plaster cast. There are few, which are it's there in the Vision 2015. If I go into that, again it will take 3 days only, not 3 hours. So, when you can just go for the basic competencies, whatever. They have to go. They can go ahead with the internship and they can reappear later. But it also forms. Why it is necessary is it forms the basis for the exit, MBBS exit. MBBS exit is also important. So it forms an. One second, sir. Like one at a time. No, sir. There is no rule as of now for any of this. They can give any number of times. As for MCI, as of now, there is nothing. No, sir. Licentiate examination only for the internship completion. It is related only to the internship completion. And this common exit examination serves both. One is for the exit, that they are qualification for them, and for the entrance exam, PG6. Louder, ma'am, please. The question remains, ma'am. Yes, even I don't know how, even I have this question. We also discussed, we also have the same question. There are certain problems, there are certain issues, challenges with NCI. I don't know how they are going to tackle. As I said, same thing. How many percentage each student will get in the first entrance? And if you again they are back to the same square one, study for the next entrance. Knowledge will be better. That is one. Another advantage is with that, ma'am. They have licentiate exam which was not there. At least they will concentrate on those basic skills. Let them study or whatever. That will serve this purpose. That will serve the purpose. At least those skills. If not anything, at least those skills they will concentrate because they have to pass through those skills. Both are the same, different, sir. They have to pass out final exam. Then after within 1 or 2 months, it's supposed to be actually they pass out somewhere in January, February. It was supposed to be in April actually, March, April. But then this time the implementation, first time they have come up with now November, December for the batch.
Regarding ranking of PG course, if a person passed out batch student will secure a higher rank, that means to say he doesn't want to take a seat for that rank, so he will reappear. But how will he be placed in the ranking list? Taking the second time in common exam.
Second time is that again he has to play second time, sir. If he is not rejected, like now also, now also you see entrance exam, so many times they rejected. They don't take, they lose their chance. That's all. Somebody else will take. Next time if he appears, it is again fresh.
The list will be the same.
No, those things will be the same. That will be the same. Again he has to reappear. It is his mistake or your mistake, whatever. It is up to them. And it is different, sir.
And they practice without taking the licentiate exam.
No, sir.
They can't.
No,
They have no choice. They have no choice. And
They have to
all
pass
will be Indian medical graduates at the end of the day.
Yes, sir.
Thank you.
Yes, sir. That is Karnataka government has coming up, sir. That is MCI still not defined anything. That is the idea of the Karnataka government, not with the MCI. So I have no idea about that. Let's keep it in. Okay. No, there will be. If you go for the NEET, you just go to the NEET website. That I'll just give you that website which is there now. If you go there, they have given everything. They will allow the seats also.
The person can focus on that subject alone during the internship.
They can. They will allow the seats. Yes, the one more thing, let me just tell you, let us not waste much of time because this doesn't come under the purview of this discussion. We have a lot more to do for the early clinical exposure and the first year changes, we have a lot more. I'll give you the website, if you go, everything is there about NEET. Let us not waste time on NEET, I think.
One more disadvantage is that students are not drawn into all courses immediately. So how will you realize which seat to take in this process?
No, I think undergraduates, as of now also we are taking the same. Undergraduates is
Research you can expose to all the things, so you know, maybe I like that branch, maybe I don't.
that also there are certain issues unanswered there now still. I think we'll leave NEET here. I think we'll go ahead with our undergraduate, which is the what is the essence of this talk. We'll go for that. So actually, I plan to omit this NEET because I knew another half an hour will go on the NEET. But then I thought because it has already come up, because NCA has already announced, I just added it up just 2 days back. Okay, now this is, I think everybody is clear what the changes, what the duration is. So first year people in the 2 months foundation course has been included. No need to get panicked that again, because they're always worried, like morning sir said, everywhere, wherever we go, everybody has the same concern that as it is 12 months are not enough. On top of that you include 2 months, then they will be left with only 8 months. So no need to worry, as of now, as it is congested, it will continue in the same congested way, it will not be more congested. So there are 14 months extra that is being given, foundation course. One more thing what they said in second MBBS, because it will be very short, which is not included here, it's there in Vision 2015, is that forensic medicine examination will be with the third first. They will learn, like in community medicine, as is now, like they will learn from second phase, they will learn, but examination will be in the third first. But along with the NT of them. They'll have to do forensic medicine at that time. That is not changed. It is as it is going on. And the classes for both forensic medicine will be distributed in second phase as well as in third first. Will be third first. Again the issues will be there that the morning somebody madam say raised that they are not reading community medicine, how to make them read because they don't have exam alone. All those are there, but we just keep it at that. We have no answers for that. Okay, now coming to the four major changes that MCA is going to bring in is that foundation course, integration, early clinical exposure, and skills training or a competency training. So one of them is first is the foundation course. Of all these things also, MCA is sitting on literally on foundation course because that's the beginning. Once they just join, the first thing all of us will be jumping in is into the ocean of foundation course. And then we may come across many others, hurdles, maybe there are sharks or whatever, but we will be jumping into that. So what is this foundation course all about? Foundation course will prepare the student to study medicine effectively throughout. It aims to orient students on various general topics and provides overview of the first year curriculum. Not only first year, whole medical curriculum also what it is like. And it helps the need is that it helps to sensitize and inculcate basic principles of self-learning, effective communication skills, medical ethics, stress management, professionalism and community health and human values. Like I think we discussed yesterday, all these have not been included into the curriculum. Maybe we are teaching directly, indirectly somewhere, but they have not been included into the curriculum as of now. So they want to dedicate 2 months for all this. And if you remember, go back over this thing, we didn't know so many things in the first year, what all it encompasses. What is there, where, in second year, what is there, third year, what is there, only when seniors told something and we believed it. So this will be given overview of MBBS. Goal is to prepare the student to study medicine effectively, one main. So the objectives, what are the objectives? What the objectives MCA has defined is to orient the orientation of the student to medical profession and to make them understand physician's role in the society. Not just as a physician, what is a physician's role in the society? And overall orientation into MBBS program. Then orient them to alternate health systems in the country. We don't orient as of now, we don't know what they are there, and we only concentrate on allopathy. There are alternative health systems, Ayurveda, homeopathy, there are so many, just orient to them. Not that we are going to teach them, just they should be made aware that these are the systems. Then medical ethics, attitude and professionalism, which is very important. all of us will feel. The healthcare system and its delivery. I think probably we get to know only when we come to community medicine posting that these are the health programs, these are the national programs and how it is delivered at different health centers, community health centers and all that. So this will be taught to them in the first foundation course. As soon as they get into 2 months, they will be aware of all this. Then orientation of the student also to national health policies and all the policies. Then patient safety and biohazard safety, all this will be taught. Principles of family practice. Indian Medical Graduate Document of MCI, they will be made aware of all the regulations of undergraduate medical this thing. I don't know about others, at least I underwent only when I became a faculty. What are the graduate medical regulations? I knew that these are the MCI regulations for our students. Only after I became a faculty I realized, but I'm during undergraduate, I never no one told me and I try to explore also. So that will be told to them. Then orient them to medical college and the existing, wherever they are working, or the hospital, each departments, what is being done in their hospital, what is going on in their college, they should be oriented. The second objective is to enable the students to acquire skills in language, which they felt that many of the time you all also agree that commonly that they have a language problem. It is language problem with English, local language problem, or a vernacular language. Then interpersonal relationship, communication. I'm sure everybody will agree this is a common complaint in our institute also that students should be taught communication skills. They don't know how to speak to faculty, they don't know how to speak to seniors, they don't know how to behave, all this communication. Then learning skills including self-directed learning. There is something like PBL, CBL, what we were discussing, self-directed learning skills. Time management, stress management. This was, they felt that it was very important because they are overburdened suddenly because they come from a 12th standard to which is very flexible. They come to this, it is very, very tightly packed, and stress management along with all the studies, they are into new environment, new college, new people, new language, new roommates, they have to cope up with everything. So with that, they felt the use of information technology. Use of information technology also. The third one was they train the student and provide skills, at least 2 basic skills is that first aid and basic life support. This is in the first 2 months of their MBBS. For first aid, they have given the list, first aid for all these, the common ailments that they come across in the community. The first aid for all those and basic life support. The next, training in language and computer skills, integrated cell biology module. This integrated cell biology module, this is integrated, which includes the basic first MBBS, physiology, anatomy, histology and biochemistry. Which module they are going to provide, we also don't know what is there inside this module. They have just given it as integrated cell biology module, which includes in the first 2 months. Because as it is, after 2 months, the first MBBS subjects will be starting, physiology, anatomy, whatever it will start. But in the first 2 months, integrated cell biology module. Then foundation course for preclinical courses. The foundation for this, which we can conduct that orientation program. In that, what they have recommended is sports 4 hours per week. Yes? 1 hour every day, like you have no games, like we had in schools, games period, PE period and all those. And extracurricular activities 2 hours per week. Extracurricular, which includes the literary, the cultural, whatever other skills. Okay, so this is what NCI recommends. Now you realize the importance of yesterday's talk, my curriculum development. You have to adjust everything within 2 months. They have given us only these many hours, this. How you fit it in is your responsibility. That's what NCI says, because we allow flexibility. Each institute is to develop in its own with a flexible way, because it should be feasible to each institute. And I'm sure at least few of you will be involved in that committee for the next 6 months to come. And out of all this, they made compulsory enrollment in one of the program at least. That is local language program. If they are very good in English, this problem they don't have, then they have to do it in a local language, or English language program if they are not very good at that, and computer skills. At least one of them. Even if they are good in all 3, they have to choose at least one of them and they have to enroll in one of the programs for this. Then this is done in the last 2 hours of the day. Till the duration of the foundation course, all these training, language program, English language, local language and computer skills will be taught to them in the last 2 hours of the day. Now I don't know where are we going to fit in those 4 hours of sports, 2 hours every day of this and 2 hours of other extracurricular. Let's see how are we going to fit it, even I don't know. Then they may continue beyond foundation courses. If these are not completed up to 2 months, every day 2 hours is not enough, they may, not that necessarily, if it is not enough, they may continue for next, whatever, beyond the foundation course. One meeting at least should be conducted during this foundation course with parents and their wards by each college. One meeting has to be announced well in advance. Call each parent. If there are 200 students, at least one parent of each and along with the students arrange one meeting for regarding the foundation course. Discuss with them what the students feel, what their ward feels about it and get a feedback. This is just to get a feedback from them and parents should be aware that this is being done for our children. They are taking care of their stress management, time management, all this. Now, professionalism. Now they have just given ethics, professionalism. Let us go little into detail of all this. What do we have to do in all this? Professionalism is a culture of institution and social and economic factors have a significant impact on professionalism. Need to teach and evaluate professionalism. Definitely there is a need. As certain behaviors during the training are linked to the future loss of relationship. Like professionalism has not been taught at the undergraduate, at the basic level. Maybe tomorrow somewhere if they don't follow it, they may lose their license. As we are seeing so many other times we've seen before. Then to make students understand, internalize and demonstrate professionalism. Internalize, this is very important term, they should feel it. Internalize the professionalism within them. Then what is professionalism? Internalizing and adhere to the set of values is a professionalism. There is a set of values behaving according to the standards that define acceptable by medical practice. This is professionalism. To profess is to proclaim publicly. To be competent to help patients and to have patients' best interest in the mind. These two basic components are the basic components of the professionalism. Such commitment invites trust from their patients. Now, if we are going to conduct professionalism course for them or to develop a module, what all the discussion includes is responsiveness to the social needs. We should tell them how should they respond to the social needs, how should be empathetic to the patients, respect for others, accountability which includes social accountability, commitment to quality and excellence, ability to deal with ambiguity and complexity and reflection, self or whatever. All these are the topics that are to be covered under the heading of professionalism. Now how can it be taught? There is one example they have given with the case scenarios. How can we teach? It's just not professionalism like yesterday we were discussing, it cannot be demonstrated, just cannot be told like this. So what can we do is, you will notice your colleague reading the record of a patient who is your colleague's friend. Record